Thank you, Kent. Can everybody hear me okay? Okay. So thank you for joining us today. As Kent mentioned, my name is Roma. I am the coordinator for the SHIP program, which is the State Health Insurance Assistance Program, and my specialty is Medicare. All things Medicare, Medicaid, Social Security, employer coverage, you name it. If it has to do with insurance, then I'm probably the one to talk to. I've been asked today to come and talk to you guys about long-term care options. So we're going to cover a wide variety of topics today. I'm happy to answer questions as we go. So if you guys do have questions, feel free to raise your hand. And as long as we're not taking up too much time, then we should be able to just take questions as they come, and we'll try and get through this as quickly as we can. So obviously, you are here at the Pikes Peak Area Agency on Aging, which our mission is to find solutions and develop programs and systems that allow people to stay in the community for as long as possible. The Area Agency on Aging serves El Paso, Park, and Teller counties. My program within the Area Agency on Aging actually serves a total of 9 counties in Colorado for the Medicare counseling. The SHIP program, which again stands for State Health Insurance Assistance Program, is a federally funded nationwide program that provides unbiased information and education on all things Medicare at no cost. And again, I cover 9 counties under that program. Every county in every state has access to a SHIP counselor or a SHIP program, if nothing else by a statewide toll-free number. So everybody should have access to someone who can provide unbiased education and information on Medicare. So just a brief overview of what we're going to talk about. I'm gonna do just a real quick overview of Social Security benefits and of Medicare benefits, and then we'll start talking about long-term care options. So we're going to start with Social Security. Social Security is, of course, an income program that we pay into throughout our work history or our spouse's work history, so that we have some sort of income at retirement. In order to be eligible for Social Security income, you do have to have a work history, either your own work history or a spouse's work history, and have earned at least what they call 40 credits or quarters, which is the equivalent of 10 years worth of work history to be eligible. Again, you can earn that off a spouse if you were a non-working stay-at-home parent, for example. But again, you have to have those 40 work quarters or credits, and that's the equivalent of 10 years of work history. You had to have been married to a spouse for at least 10 years to draw off their work history if you were a non-working spouse. The earliest you can start drawing Social Security based on retirement is age 62. That is considered early retirement age. Right now, full retirement age is 66 and I want to say 6 months. And as time goes on, that increases to 66 and 9 months, 66 and 10 months or 11 months, and then 67. I think it maxes out right now at 67, but that could change in the future. The oldest you can be without drawing Social Security is 70, or that's the longest you can pay into the Social Security system. So if you continue to work past age 65, you continue to pay into the Social Security system through payroll taxes. You will continue to contribute and increase your Social Security income for as long as you continue to work. But once you hit age 70, your contributions cease. And that's the highest level of income you can earn, is working until age 70. So there really is no benefit in waiting any time past full retirement age or past age 70 if you do continue to work. Social Security offers survivor benefits for people who have been married, but their spouse has passed away. And that can be through current spouses, ex-spouses. It can also apply for dependent children and dependent parents. And you can receive up to the full amount of the deceased worker's income. But you can't draw two incomes. You can't draw income based on your own Social Security history and the deceased worker's history. You get the greater of whichever income was higher, but you only get the one income. You can also earn Social Security or draw Social Security benefits based on disability. Yeah. Through early retirement. Yes. So for anybody who decides to draw Social Security early prior to full retirement age, which again right now is like 66 and 6 months, if you also have employment where you're paying taxes or paying into the tax system, they are going to deduct $1 of your Social Security for every $2 you earn up to the first 15,000, and I don't have the number for 2024, but 15,000 and something per year. Well, it might be 18. Mhm. Whatever that limit is, and again, I apologize, I don't know the limit for 2024, and it could be up to 18 at this point. It's been a while since I've had to look that number up. But it's up to, and that's a federal limit. So you can earn up to X amount of dollars, and then they start deducting $1 for every $2 you earn beyond that. And so if you're earning a significant amount of income, it may eat away all of the Social Security retirement income you're collecting. So it's not always beneficial to collect both in that kind of situation if you're still able to work. Might just be better to continue to contribute into that system and draw later. And keep in mind that if you start drawing income prior to full retirement age, that amount that you're drawing is reduced because you're spreading it out over more years. So you get less in Social Security for every year you are collecting it before full retirement age. You can. It's a little messy to do so, but theoretically you can. And if you are continuing to work while you're drawing Social Security, keep in mind that you're still contributing into that tax system. So they're still adding that tax credit to your income. So they're going to recalculate your income every year because you're still paying into it. So they have to recalculate it based on how much more you paid in the last year. And that can be a little messy as well, because then you might never know exactly what your real income is. Because as we all might know, Social Security is not very timely or efficient when it comes to doing those things in a quick manner. So, I mean, if you can wait, if it's beneficial to start collecting early, if you can wait till full retirement age, it just really depends on your specific situation. But that's why they have all these options, because everybody's situation is different. And so you just got to figure out what works best for you. Again, Social Security also can be collected under disability benefits. Disability benefits are typically going to apply to people under full retirement age. And it's going to be something that you have been determined to be disabled, meaning you're unable to have gainful employment as determined by Social Security based on medical records. Before you can start collecting disability payments are going to be based on how much you've paid into the system up until that point. And what your earning potential might have been had you been able to continue to be gainfully employed. If you are approved for Social Security disability, you receive at least 24 disability income payments, you would automatically become eligible for Medicare at the 25th payment, regardless of age. Once you reach full retirement age, the disability status drops off of your Social Security and it turns into retirement status. Nothing else changes. Your income doesn't change. Nothing else changes, just the status. And then for people who have very, very limited income or resources, there is supplemental income, supplemental security income, or SSI. And this is for people, again, very limited income, was not able to pay into the system for whatever reason, has an income under federal poverty level. SSI could supplement whatever income you do have up to the federal poverty level as far as an additional income, and that would provide some additional medical benefits through the state's Medicaid programs, that kind of thing. But it's only going to increase income for a total up to whatever the federal poverty level is for that year. Obviously, Social Security rules can be a little complicated. There's a lot of what ifs and a lot of situations that they can take into account. Unfortunately, Social Security is usually the only one who can answer questions about Social Security, and they are very, very protective of that right. So they will not usually talk to anybody else besides you when it comes to determining what benefits you're eligible for, giving you estimates. They do not acknowledge power of attorneys. You would have to assign what they call a representative payee if you want them to talk to anybody besides yourself. And that's an internal form that you have to request and then submit to them. You can get a lot of information from the Social Security website, and you can create a personalized account on the Social Security website that can provide you with estimates and stuff like that, copies of documents that they may have sent. So there's a lot of benefit to creating an account on Social Security's website, but it's not required to apply for Medicare or to apply for benefits or anything like that. You can try and contact Social Security at their toll-free national number, which I provided on the slide. They're available from 7 a.m. to 7 p.m. in all time zones, Monday through Friday. I've also provided the local Social Security office contact. Whether or not you have any luck contacting them is kind of up in the air right now. But again, Social Security will only talk to you if you have questions or if you need to verify benefits. Theoretically, you can. In reality, I've had people tell me that they've done that, and by the end of the day, when they finally got up to a window, they were told that they couldn't be helped. I strongly encourage people to go online if they can, or to try and call the toll-free national number. I can tell you that if you call later in the day, later in the week, and later in the month, and the closer you can get those three things together, the more likely you're going to get through to the toll-free national number. Because later in the month, they're less busy. First of the month, they're most busy. But again, later in the day, they're less busy. Later in the week, they're less busy as well. They discourage that because you're not that person. And that's all I'm going to say about it. They discourage it. If you become the representative payee, meaning the beneficiary, in that case, your mom, would have to request a representative payee form, fill out that form designating who they want to be their rep payee so that that person can talk to Social Security, submit it. Takes 4 to 6 weeks to be put in the system, and then you could talk to them on behalf of that person. Yep. Any other questions about Social Security? All right. So we'll talk real quick about Medicare. Medicare benefits are the federal health benefits that we earn by paying into the tax system. Eligibility for Medicare is automatic as long as you are a U.S. citizen and you turn age 65 or older, or if you've been determined to be disabled by Social Security and you've received at least 24 disability payments. Also, if you are legally residing, meaning you have a green card, if you've lived in this country for at least 5 consecutive years, you are eligible to purchase Medicare. And all eligibility is determined by Social Security for Medicare. So if you're not sure if you're eligible for Medicare, or if you have enough work history paid into the system to be eligible for Medicare, Only Social Security can tell you that. To enroll in Medicare, only Social Security can do that. So you have to enroll in Medicare through Social Security as well. Once you're enrolled in Medicare, Social Security doesn't want anything to do with Medicare. They can't answer questions. They can't tell you anything about Medicare. Their only job is to determine if you're eligible by paying into the system and get you enrolled into Medicare. After that, their job is done. There are some situations where people may be automatically enrolled in Medicare, and that would be if you are collecting a Social Security income prior to eligibility. So if you are collecting Social Security disability under age 65 and you've been on disability for 3-4 years, you're getting ready to turn 65, you're automatically enrolled after 24 months into Medicare because you're collecting Social Security at any age. When you turn 65, nothing changes because you're already in Medicare. If you're collecting early Social Security income or early retirement income, you'll be automatically enrolled in Medicare at age 65 simply because you're collecting a Social Security income. If you're not collecting a Social Security income when you become eligible for Medicare, whether it's due to age or disability, it becomes your responsibility to tell Social Security whether or not you want to enroll in Medicare. They won't automatically enroll you unless you're collecting an income from them. If you don't want to enroll because you're employed with employer group coverage or you have coverage through a spouse, that's fine. And you don't have to tell them anything until you're ready to enroll because you lose the employer coverage. But if you do want to enroll at retirement age, you do have to contact them. You have to be proactive to do that. Eligibility for Medicare is 65, regardless of eligibility or retirement age for Social Security income. Eligibility for Medicare is still age 65. That has not changed. The only good excuse Social Security accepts for not enrolling in Medicare when you first become eligible, whether it's due to disability or age, is if you are covered through employer group insurance through active employment, either your own employment or a spouse's employment. Active employment can't be retirement coverage through an employer, can't be, you know, marketplace coverage. You have to be insured, medically insured through active employment through your own employment or a spouse's. And if that's based on turning 65, you have to have work for an employer with at least 20 employees. If it's for someone on disability, you have to work for an employer with at least 100 employees. If you are not insured through active employment and you do not enroll in Medicare when you turn 65 or first become eligible, Medicare will allow you to enroll anytime in the future, any year down the road during a general enrollment period, but you'll be penalized for not enrolling when you first became eligible and not having that excuse of active employer coverage. You'll pay more, basically, to have Medicare in the future. So it is to your benefit to enroll when you first become eligible unless you have that employer group coverage. The penalty for Part B is 10% for every 12 full month period that you went without. So right now, the Medicare premium is $174 and change. If you wait 3 years to enroll in Medicare, you weren't actively working, that's 30% increase to the premium of whatever the premium is 3 years from now. And that premium doesn't go up every year. So the longer you wait, the more it adds up. If you wait 10 months past your eligibility age, that's not 12 months, there'll be no penalty. But if you wait 2 years, 3 years, 5 years, it's 10% per year accumulative, and it's going to be based on whatever that premium is when you actually enroll. So it does add up after a while, and that premium penalty is tacked on top of. So they would take, for example, that 30% times the premium, whatever that comes out to, is tacked on top of the monthly premium every month for life. It never goes away. So it can add up pretty quickly. And you're limited to when you can enroll. If you didn't enroll when you first became eligible, there's one time a year between January and March each year that you have the ability to actually enroll in Medicare in that scenario. So if you miss the first year, you have to wait another full 12 months, which means you have another 10% penalty. So unless you have employer coverage, it's to your benefit to enroll. There are specific enrollment periods you do need to be aware of when it comes time to enroll in Medicare. You have your initial enrollment period, which is usually going to be surrounding your 65th birthday, which is the 3 months prior to, the month of, and 3 months after the month of that 65th birthday, or the month of eligibility based on disability. So if you're only 45, but you're getting Social Security disability, you still get a 7-month window surrounding that 25th disability payment when you become eligible for Medicare. There are special enrollment periods. So if you don't enroll in Medicare because you did have active employer group health coverage, when that active employment ends, you get what they call a special enrollment period, meaning whenever that coverage ends, you get an opportunity to enroll in Medicare without penalty. And that's up to an 8-month window after the active employment ends. So you actually get an extended amount of time to enroll in Medicare because you delayed based on active employment. And then the annual general enrollment period, that's the one I just mentioned, where you have to wait the full 12 months before you can try again to enroll in Medicare without penalty. That's that January through March period for people who didn't enroll when they could have and didn't have employer coverage. For most people, Medicare Part A will not have a cost. If you pay into the system, you earn those 40 credits paid into Social Security, or that 10 years worth of work history. Part A is free, and Part A covers inpatient services, hospitalizations, inpatient rehab stays. Part B is the part of Medicare you pay for. That's the part that actually has a premium for most people. Again, $174 and change this year. Everybody has to pay for Part B unless you qualify for financial assistance for that. Everybody pays for Part B. Most people get Part A for free. If you had to pay for Part A because you don't have enough work history paid into the system, the premium this year is $600 a month just for Part A. And then you'd still have to pay for Part B. The third part of Medicare nowadays is Part D for drugs. That is the prescription benefit that was added to Medicare in 2006. Everybody, and just to be clear, all of these benefits are optional. Nothing says you are required to enroll in any of this. It is optional. But if you don't enroll when you first become eligible and want to enroll later, such as when you develop health problems, that's why they're going to make you pay more for not having done it when you first became eligible. Part D is optional, of course. It is the drug benefit for prescription drugs that you get at a pharmacy. And some people may have heard the phrase Part C of Medicare, which basically refers to Medicare Advantage plans, which is an insurance option for Medicare. I'm not going to go into any of those specifics, but if anybody's interested in more information about the specifics of Medicare, I do Medicare 101 presentations, and we do have some previously recorded presentations on our website that we can direct you to until I start up the new cycle for this year. Costs with just Medicare, there are deductibles, there are co-insurances. So if you have a hospital stay, Medicare pays everything for that inpatient stay except $1,600 deductible. But that's your total out-of-pocket cost for an inpatient stay. So whether it's a $5,000 hospital stay or a $500,000 hospital stay, your total out-of-pocket would be the $1,600 deductible. For outpatient services under Part B, it's an 80/20 after less than $300 deductible. So total out-of-pocket costs with just Medicare are not outrageous. They're limited to what Medicare approves and the balance that they leave over for you. There is financial assistance programs available to help with some of those costs of Medicare called Medicare Savings Programs. These are federal programs that are designed specifically and solely to help cover the costs of Medicare, such as the Medicare Part B premium, maybe your deductibles and co-insurances. You do have to qualify financially based on income and assets. You do have to apply for those programs, even though they're a federal program, you apply for them through the local Department of Human Services. So basically, it's a Medicaid application. We do help with those applications here at our office. There's also financial assistance specifically for Part D drug coverage of Medicare. Has slightly higher income and asset limits, so more people should qualify for help with the drug benefits of Medicare. And those benefits do continue to get better every year. Specifically right now because of the IRA, what does the IRA stand for? Inflation Reduction Act. Thank you. So those benefits continue to get better every year and will continue to get better over the next several years to reduce drug costs for beneficiaries. Again, we're the Medicare counselors for this area. Anybody has any questions about any part of Medicare or financial assistance for Medicare, you're more than happy to talk to you about any of those topics, and we can assist with applications as well. Again, there's a lot to Medicare. There's a lot to know. There's a lot you should know. Options continue to increase in variety as far as the types of coverages that are available to choose from. I'm sure people who are turned 65 or are turning 65 have been inundated with junk mail on all different kinds of insurance options. We can help disseminate all of that information for you if you're interested. You can always call 1-800-MEDICARE. There is no local offices for Medicare. You cannot go talk to them. You can only contact them by their toll-free 1-800 number, or you can chat with them on their website. Or you can come talk to us and we're happy to help. All right. But the bottom line is none of those options provide long-term care benefit or service. And that is the main topic for today. So any questions before we move into the next topic? Okay. So I'm going to start with long-term care insurance. So we're going to talk about three main options for long-term care, which is insurance, Medicaid, or VA. Long-term care insurance is something that if you wanted to purchase is something you should probably purchase between age 45 and 55 when it's affordable and when you are more likely to be able to pass underwriting. Because long-term care insurances do underwrite, meaning they will look at your health history, and if they do not like what they see, they will not sell you insurance. Long-term care insurance gets more expensive the older you are, regardless of health. And long-term care insurance gets more expensive the longer you have it. So even if you bought it when you were 45, you had reasonable premiums. When you reach 65, 70, those premiums start going up. And I've seen many a time where those premiums go up to an unaffordable amount and people end up dropping that coverage, which really, really bothers me because after you've paid into that system, into that insurance for 20 years, to drop it is losing all of that money. So it's very, very frustrating. And long-term care insurance really is not for everybody. It's not the end-all solution, regardless of whether or not you can afford it. I pulled up a few statistics from last year or from 2021 about the average monthly cost for long-term care services. Not cheap, as we all know. And long-term care insurance is not designed to cover all of these costs. Long-term care insurance is designed to supplement paying for these costs. So if you purchase long-term care insurance, you're basically going to purchase something that will cover maybe 2/3 of your long-term care costs per month. It's not designed to cover 100% of those costs. But again, premiums go up as you age. Medical history plays a role because of underwriting. Once you've passed underwriting and purchased, you're guaranteed renewable as long as you can pay the premiums. They can't drop you because you develop health issues in the future. But the longer you have that policy, the higher the premiums are going to go. But you have a lot of options to choose from when you're purchasing this kind of coverage. You can kind of pick and choose what benefits you want it to cover if you ever need to access them. You can pick how much benefit you want to purchase. Do you want to purchase $60,000, $100,000, just depending on what your needs are. You can sometimes get reduced premiums if you purchase it as a married couple. Definitely, you can save some money if you purchase as a married couple, but just to let you know, women do tend to pay higher premiums than men, which I think is really interesting because it is the opposite when you're looking at health insurance. Women tend to pay lower premiums for health insurance than men because we tend to keep ourselves healthier, but we pay higher premiums when it comes to long-term care insurance because we tend to use it longer, because we live longer. So insurance is not a pretty business, unfortunately, any kind of insurance. But you can get quite a significant discount if you buy it as a married couple. If, as the slide shows, the older you get, the more expensive it becomes, and premiums just continue to increase as time goes on. But you can pick and choose whatever you want it to cover, however you want it to cover. Now, all policies will have requirements in order to access them. If you've purchased them and time comes that you need to start using benefits, most policies will require that you have a need for at least 2 activities of daily living before you're eligible to start using benefits. So those activities of daily living are help with dressing, bathing, toileting, transferring, eating, or if you have cognitive issues, that can be an automatic qualifier. But it can cover a whole variety of services: in-home care, nursing home care, respite care, memory care, adult daycare. You can pretty much get whatever you want and pick and choose between all those services and how much of those services you want to purchase. Correct. I'm talking about something you go out and buy for that purpose, and that's why it's so expensive. Now, Colorado does participate in the Long-Term Care Insurance Partnership. This is a program that's designed to encourage people to purchase long-term care insurance for their future needs by allowing you to retain assets if you use your long-term care policy and max it out, and then have to apply for Medicaid. It allows you to retain assets when you apply for Medicaid instead of having to spend them down. So if you had $100,000 in assets, you had a long-term care policy that you actually had to start using, you maxed out the policy, and now you have to apply for Medicaid because your policy's been maxed out. You still have $100,000 in assets, you'd be allowed to keep those assets and still qualify for Medicaid under this partnership. And that's what's supposed to encourage people to purchase long-term care insurance, regardless of any of the other factors. There are several states that do participate. I don't think all states participate with this program, but Colorado has participated since 2008. And most policies are going to be partnership policies automatically, but it is always a good idea to ask when you're talking to an agent if this is something you're looking into. Make sure it's a participating partnership policy. Yes. So you got that notice that says you could be subject to a state recovery. Everybody got that notice. Everybody. And what that means is when you are no longer in need of long-term care Medicaid services for any reason, you passed away, you recovered, whatever, the state could, not will, but could pursue recovery of the costs that they had in providing you with long-term care services by putting a lien on your estate or what have you. Doesn't mean they're gonna, just means they could. then they're not gonna. They're only gonna pursue that for people who actually had resources or estates that they could recover monies from. And even in that situation, it would have to be enough monies to make it worth their while, meaning make it worth the court costs and all of that to be worth it to pursue. No, because everything, like in a joint account like that, everything's split down the middle. But honestly, if someone's on long-term care Medicaid, there shouldn't be a joint account like that that would be any of the daughter's resources. Yep. Any other questions? Okay, sure. Mhm. So if you're looking at Medicaid eligibility, that's not good. S- Because the state is going to look at that as he could have liquidated those assets to continue to pay for his long-term care needs and exhausted those assets before he was asking the state for assistance. By giving those assets to somebody else, he basically is trying to skirt the system, and he will be ineligible for applying for long-term care Medicaid for however long they determine those assets were worth or would have covered his care. So, I mean, it depends on what it was. It depends on what it was. So, like if it was a home that was quit claimed to you or something like that, it can be quit claimed back. Um, if it was cash assets, you know, they're gonna question that for sure. And it may still make him ineligible for however long it's been since that happened. But certainly would be something you'd want to talk to them about. How can you correct it? As long as those assets are still DHS, Human Services. Yeah, whoever you're applying to. Yeah. No, there's community spouse protections so that the spouse that's not needing the assistance through Medicaid gets to retain the home, the primary vehicle, and up to, I want to say 136,000 in liquidatable assets right now. And that number goes up every year. So the whole point is so that the spouse isn't impoverished simply because the other spouse needs assistance. Depends on what kind of trust it is. There are a couple of trusts that they are are willing to work with, and other trusts that they are not would have to be dissolved. So there are about 5 or 6 different trusts that they talk about in the state regs, and only 1 or 2 of them are acceptable. And I can't remember off the top of my head which 2 they are, but certainly that's something that you'd have to show the trust documents to DHS when you apply so that they can review and see if it's a trust that they can allow you to keep or not. Otherwise, it would have to be dissolved. Yeah. And I know I'm down to my last couple of minutes. Um, I did provide some resources if you wanted more information about long-term care insurance. Um, we've covered a couple of questions about Medicaid long-term care benefits. There are some resources. There's a booklet that our office puts together and distributes every year that describes long-term care Medicaid benefits and other Medicaid benefits for older adults, how to apply for them, what the eligibility criteria is, also discusses veterans benefits eligibility and criteria and how to apply for those benefits. Um, this will be updated as soon as the new federal poverty level numbers come out and they update the income and asset limits for these programs. But you guys are welcome to these booklets. We have some over here on the table. If you have any questions about any of this, we are always available to answer questions and sit down with you and talk about specific scenario that you might be in and how any of these programs might apply and what eligibility there might be for you guys. So I do apologize that that I took too much time and didn't get to the more Medicaid benefit or VA benefit slides, but within the handouts, there are some additional resources that you can reference online. Welcome to these booklets. Welcome to come and talk to us. Give us a call. We'll schedule an appointment. Yeah, absolutely. Give us a call. Just tell whoever answers the phone that you need to talk to someone about Medicaid, long-term care, or VA benefits, and you should be routed to one of the SHIP counselors. Yeah. Yeah. Yep.
How you ask the question determines how accurate you get connected.
I mean, eventually we'll get to the right person. We'll get you there.
Yeah.
Again, always available. Just give us a call. We'll schedule an appointment for you or hopefully answer the question over the phone or whatever we need to do. Okay. You're welcome.